Hello, my name is Crystal Curley and I'm a student at UAGC. I will be presenting on major depressive disorders, starting with some theories, treatment options, and some alternative approaches. I will be referring to a major depressive disorder in this presentation as MDD for short. MDD is considered a chronic disabling and recurring psychiatric condition foremost and is exemplified by depressed mood, reduced interest and in pleasure activities, weight changes, sleep, psychomotor distress, fatigue, feeling worthless, concentration issues, and suicidal ideation. So it's looking into the facts about MDD. It is disheartening that many struggle with this daily and is considered a major public health crisis, with 10.8% worldwide suffering from MDD some point in their life. Cognitive impairment is a common symptom that impacts 40% of those who are or have had MDD. And this cognitive impairment impacts the quality of life and daily functions. Stress is believed to be the leading cause of MDD. Now we will review the brain side with the neurotransmitter and receptor theories of MDD. So here, MDD is believed to be multifactorial. That includes biological, genetic, environmental, and psychosocial factors. The neurotransmitter theory listed as the most common for MDD is monoamine hypotheses, due to being simple and understandable, but it might not fit quite fully. Monoamine hypotheses focuses on the monoamines like serotonin, noradrenaline, and dopamine, with synaptic gaps that are decreased during the depressive states. An issue with this theory lies with the latency of response with antidepressants that are based off of this theory. This has led to neuroplasticity and neurogenesis hypotheses. So neuroplasticity hypotheses suggest that stress and glucocorticoid, GC, induce the atrophy of mature neurons in the hippocampus, and neurogenesis hypotheses suggest that the stress, GC, decrease the number of newborn neurons and neural precursor cells and the donate gyrus DG of the hippocampus. Those are a couple of theories that we will review that kind of outline the basis of MDD. Next, we're going to move into the drug treatment that is currently approved by FDA. The current FDA approved medications used to treat MDD are the following antidepressants. I'll be reading overall group names and not the individual medication names. So the first is selective serotonin reuptake inhibitors, SSRIs. And so this is usually considered the first line of treatment. The second is serotonin, norepinephrine. I'm so sorry, I'm chopping this up a little bit. Serotonin norepinephrine reuptake inhibitors, SNRIs, which are commonly used for MDD with comorbid pain disorders. The third is serotonin modulators. The fourth is atypical antidepressants that can be used with patients who develop sexual side effects to SSRIs or SNRIs. Next is the tricyclic antidepressants, TCAs, And the last two is monoamine oxidase inhibitors, MAOIs, which are not as common due to the side effects. The last is other medications include mood stabilizers and antipsychotics that can be taken with in combination of other antidepressants as well. Moving to the next slide. So I will focus on the SSRIs and how they affect neurotransmitter systems. SSRIs are the first line of treatment with MDD and works by raising the serotonin levels in the brain by blocking reuptake, since low levels of serotonin leads to depression. The cost of MDD treatments will vary since the medication selected may differ. Average cost of medication depends on the type of drug, whether it's generic or a name brand, dosage, and insurance coverage. One example of SSRI, fluoxetine, costs $4 for a 30-day supply. $4 may not seem like much, but every household differs, and that makes it harder for some. Next, we are going to talk about common medication risks. Some common SSRI side effects is a quite long list here. Sexual dysfunction, bleeding, serotonin syndrome, discontinuation syndrome, bipolar switch, nausea, anorexia, and insomnia, just to name a few. Breaking down one of these, specifically serotonin syndrome, speaks to the seriousness of this side effect. The excessive stimulation of serotonin receptors can be seen through nausea, diarrhea, restlessness that leads to serotonin syndrome, and in most severe cases can cause cardiovascular collapse, coma, and even death. So looking at the risk and benefits of this, MDD treatment is crucial to our health and our life, especially those who struggle. One of the symptoms is suicide ideation, and if MDD is left untreated, it may have a deathly price. Treating depression can be costly. However, there are things we can do that have a positive impact, like getting enough sleep, exercising daily, deep breathing, and trying to, meet up with friends and family. A few alternative treatment options is through using medicinal plants that acts as an antidepressant effects by neutralizing various stressors and returning monoamine receptors and neurotransmitter levels to normal. The two I will mention here are soy and green tea. Soy has a moderate to strong potency, improves quality of life and depression symptoms. Green tea has a strong potency, works to protect neurons against inflammation in hippocampus. The other two treatment options are like psychotherapy, which include cognitive behavioral therapy to transcranial magnetic stimulation, TMS, which is only for patients who have failed at least one medication trial. Apologize if you hear my cat in the background. Just in conclusion, MDD impacts a large portion of our population worldwide. It could be that we have been, impacted ourselves, or someone we know has been impacted by MDD in some form. Learning more about MDD can help us and help others too. Thank you for listening to my presentation, and please let me know if you have any questions.